In this video, we'll take a look at how wearing different shoes can affect your pelvic and shoulder mobility. You'll see me walk in each pair of shoes and then go through some series of testing to show how it affects the mobility in both my hip and my shoulder. This first pair of shoes is a New Balance Fresh Foam Rover. They're not normally what we'd consider a recommended shoe through the PRI or from the Huruska Clinic shoe list. And after taking a walk, you'll see Dr. Megan moving my hip, and then as she moves back, we're limited in how far she can move my leg down towards the floor. As she moves up towards my shoulder, she'll test the motion and she'll feel a hard stop about 30 to 45 degrees there in the shoulder. This next shoe is the Asics GT 2000 version 12, which is on the 2024 Huruska Clinic shoe list. So this is an approved shoe. It has the qualities that we look for, but this just testing goes to show you even a good shoe does not always mean it's helpful for your body, as you can see by the lack of mobility in my hip there, surprising Dr. Megan, and also does not help me with my shoulder mobility. The last shoe I'm wearing is the Brooks Adrenaline GTS 23. This is also on the Huruska Clinic shoe list for 2024. And as we watch this, you'll notice how much more mobility just walking in that shoe for a few seconds gave my hip. My knee is able to move all the way to the floor without any resistance. And then we'll assess the shoulder mobility as well. And we'll see that I now have full range of motion all the way down to the table. I hope this video helped to show you how your choice in shoes can influence your body and possibly help or hinder your rehab. I will place a link below to the Huruska Clinic shoe list so that you can check out this year's recommended shoes.